So welcome this evening to the Eastern Shore Regional Office in the Southern Maryland DDA Community Meeting for collaborative conversation sessions. All right, we're going to run through. My name is Renee Abrams-Sanzoni. I'm with the Parents Place of Maryland. I'm going to be being your facilitator tonight. And so I'm really looking forward to it. But before we get started, there are a few housekeeping things that we probably need to go over for our folks online. Are you looking seamless? Oh, perfect. Next slide, please. All right. If you are needing closed caption, you'll see your bottom right-hand screen to click on that for closed captioning. And if the mics and cameras are turned off for right now. If you would like to click to post a comment, you'll see the comment tab up at the top right-hand corner. And we will be reading those aloud later in the meeting. We are also, if you would like to ask a question out loud, you will be able to raise your hand to ask that question. And we will call on you, and we'll try to make sure we're doing it on a rotating basis for those of you that are online and for those of you that are here in person with us tonight. All right. So we do understand, I understand, at the Parents Place of Maryland, we get calls from families and providers all the time. So we do understand that this is a very emotionally charged and time, and it also feels very frustrating, right? These are the comments we've heard in the other listening sessions for families and for providers. So we really want to make sure, I want to make sure that you hear that we really are acknowledging that. But given that, there are some ground rules around conduct, folks. So we really do want a free expression of diverse viewpoints. It is a fundamental value of the group. The freedom carries the responsibility to engage respectfully, which means treating one another with dignity and respect and good faith. Uncivil behavior, disruptive actions, abusive language, threats, or harassment won't be tolerated and may result in removal from the meeting. So please, we're here to hear and to share. And so I really appreciate everyone abiding by these rules of conduct. Next slide. So we have some group norms. We definitely want one voice at a time, so everyone deserves to be heard in the room and online. We are going to limit the questions to 1 minute. We want to make sure that we're sharing the space so that all voices can be heard. And we want to listen with respect, avoid interruptions, and really honor each speaker's perspective. At the end of the collaborative conversation and the sharing out, we're also going to share next steps of what's going to happen after this, which is always really super important. All right, our agenda for the night. We are going to be, I have already introduced myself, definitely want to welcome. We are going to take a moment and let the DDA folks introduce themselves so you all know who's in the room, because they're all going to be helping to answer the questions that you all share. They're also going to be sharing out all of the things they heard from multiple listening sessions across the state, and then we're going to open it up for the collaborative discussion where folks have a minute to share, and then we'll go through with answering questions from there. So there are lots of really fantastic DDA folks in the room. So I am going to start with you, Marlena, and do you guys have a mic on the table? And then we can help pass it around and do some brief introductions of all of you all.
Good evening, everyone. I'm Marlena Hutchinson. I'm the Deputy Secretary for the Developmental Disabilities Administration. Thank you so much for coming out, those of you in person, and thanks to those online who are joining us this evening.
Good evening, everyone. My name is Robert White. I am the Chief Operating Officer for the Developmental Disabilities Administration. It's great to see you here and those of you online as well.
Good evening. My name is Allison Wool. I'm the Chief of Staff. evening, everyone. My name is Vanessa Duke, and I am the Regional Director for the Southern Maryland Regional Office.
Good evening, I'm Rachel White, I'm the Director of the Eastern Shore Region.
Good evening, everybody. My name is Wesley Huntsman. I am the Director of Administrative Services for the Developmental Disabilities Administration. Great seeing you all here in person and for those online.
Good evening. My name is Rhonda Workman. I'm the Director of Federal Programs for the DDA.
Hello, my name is Nova Evans. I'm the Director of Cost Systems Innovation for DDA. Good evening, I'm Carolyn Daly. I'm the Director of Quality for the Eastern Shore Regional Office. Hello, everyone. My name is Anne Fahey, and I'm a member of the CCS squad at the Eastern Shore Regional Office.
Good evening, everyone. My name is Regina Sazur. I'm with Professional Development. Welcome. And for those of you online and those of you here, welcome.
Good evening, everyone. My name is Joseph Kamara. I'm the Quality Assurance Analyst Supervisor at the DDA Service Desk.
Right, is that everyone? Okay, so it seems to be that folks online are having a hard time hearing us. Thank you. You're hearing? Okay, all right. We are working on the sound. We do know that the interpreter can hear us. So I am so sorry. So we do we want to take a moment to see if we can, because we're getting ready to transition to the section where Marlena is going to be sharing what they've learned from these listening sessions, and I want to make sure folks can hear that. Oh, it sounds like folks can hear us fine now. Whatever you all did, DDA tech folks, thank you so very, very much, because I assure you it is beyond my pay grade. All right. Without further ado, if you don't mind, the next slide, please. We've done the welcome. All right, I am going to turn this over to you.
So good evening again, everyone. Marlena Hutchinson, the Deputy Secretary for the Developmental Disabilities Administration. Again, thank you so much for joining us this evening. We wanted an opportunity to continue our ongoing and continuous feedback loops with you all, as we mentioned during the 6 different sessions that we had with the community over the last 6-7 weeks. We've heard you all, and we really want to thank you all for answering our questions, for coming out to talk with us, to share your most intimate thoughts and deep thoughts about the DDA service delivery system overall. And so we really appreciate that. We pulled out some common themes, and hopefully you had an opportunity to see our communication that went out last week as well. We wanted to share the common themes in our follow-up in advance of this series of meetings, just for your situational awareness, and then we'll talk through those throughout the evening. We identified, by way of your very helpful feedback, 5 cross-regional areas of improvement. And we were very intentional as to why and how we hosted our community engagements. We wanted to make certain that we were out in every region of the state and before every stakeholder in the state to understand what your experience has been with DDA. So thank you so much again. Some of the themes that we saw, there were like 5, or heard, there were 5 common themes more than anything. Those are communication failures, damaged trust, confusing policy changes, a very complex system, and a desire for genuine community partnerships. So what the team and I are going to do tonight is talk about those common themes that we've heard and then share our follow-up and then open the floor up so that we could have additional dialogue and conversation with you. If you recall the last series of meetings, we had 6 meetings where DDA posed questions and we heard from you because we heard also as a part at the beginning of that entire process was DDA is just talking to us. We don't get an opportunity to talk to DDA. So we wanted to extend that platform and opportunity so that you all could share openly with us. Tonight, it's going to be interactive. So you'll be able to ask questions. DDA will be here to answer. And again, this is the series of ongoing and continuous feedback loops that we will continue to have with you all as our community partners. Next slide.
Thank you, Deputy Secretary Hutchinson, and good evening again, everyone. So playing off the first theme, communication failure, we're going to go through the themes and provide a little more detail based on the information and feedback we received. So we heard communication is the primary failure point with inconsistent and incomplete information sharing and limited responsiveness. So what are we doing? We're strengthening our partnerships with case management, our fiscal management and counseling services agencies, and Medicaid partners, aligning more closely to make sure that messaging is consistent and training materials are updated with recent policy changes. We're also establishing clear expectations for timely responses and follow through. We're standardizing communication channels and message content to ensure consistency. We're also improving proactive information sharing so that stakeholders are not left seeking updates. Next slide.
The second thing that we heard, an overall theme, is around damaged trust. And so what we heard was trust has been significantly damaged due to rushed processes and limited transparency about the reasons for changes. What we're doing, hopefully you all have seen an increase in our community engagement. We are creating work groups and platforms for all of you and a broad array of stakeholders to engage more frequently with us, specifically the Waiver Advisory Council. So we started that Waiver Advisory Council October of 2024. We were meeting bi-monthly. This summer, we increased that frequency to monthly, and so we continue to offer that platform. Another committee that we have formed is the Maryland Intellectual and Developmental Disabilities Sustainability and Equity Committee. And we have a whole host of other community engagements to come in 2026. We are also going to be slowing down decision-making when feasible and when needing to communicate timelines. We heard we are moving too fast. You're pushing, you're moving too fast, and there's not an opportunity for us to understand or keep up to speed with what DDA is doing. So we'll be slowing things down. You also asked about clear guidelines, direction, and so forth. So we are working with our trusted partners within the department, along with you all, to establish clear explanations for our proposals, any changes that we plan to implement, including data, goals, and constraints behind them. Another thing we're doing is engaging stakeholders earlier and in a more meaningful way throughout the process. So as you all know, the Maryland Intellectual and Developmental Sustainability and Equity Committee, also known as MIDSEC, started coming together the first week of October, October 7th, to start talking about DDA's cost drivers, how the system is just inaccessible for many, how it's inequitable for many. And so we'll continue doing more work like that as decisions are being vetted, socialized, and made. And then establishing transparent feedback loops so concerns are heard and responded to. We hope that last week's communication around the common themes that we heard, that we shared in advance of this meeting, is one that you have received as being transparent, and we will continue to operate in such manner.
Moving on to the third, confusing policy changes. So we heard policy changes are confusing and community partners feel that they are unintended consequences to these changes, which may be resulting in service disruptions and a lack of clarity about administrative and reimbursement requirements. So what are we doing? We're clarifying policy language and publishing updated guidance in plain, consistent formats, as well as translating documents into Spanish in an effort to make our materials and resources more accessible. Hosting targeted training, webinars, and Q&A sessions to ensure shared understanding. Within the next few weeks, you'll be seeing little 3 to 5 minute video clips to help explain some of the more complicated changes in plain language without sending out a lot of text documents. Identifying and addressing unintended impacts, especially those affecting service continuity and quality, and establishing a structured feedback process before future policy changes are finalized.
Another thing we heard about is how complex our system is. When I came in as deputy secretary last year, I heard about some of the unfortunate experiences that family members and participants were actually encountering because we had 3 different Medicaid waiver programs. If a person's needs change, the individual would have to disenroll from the program and then go through a whole other enrollment process in order to continue services. As a result of that very helpful feedback, the DDA has since consolidated those 3 Medicaid waiver programs into one, effective October 6, 2025, and that waiver program is the Community Pathways Waiver. We also heard about how things continue to be inaccessible, especially for families with language barriers and varied cultural dynamics, as well as aging caregivers. So what we're doing is actively working to simplify our forms, our processes, our guidance, and we're working with our partners such as our case managers, also known as coordinators for community services, on things like administrative burden. We are expanding our cultural and linguistic communications in a very appropriate way. And we're also working to translate our documents and also host sessions in Spanish as frequently as possible and as much as possible. We were very proud when we were able to host our first all Spanish speaking listening session on November 10th. That was something that was a Herculean effort. In order to access and provide access to those families. So online, we're having some Wi-Fi issues. Can you all hear us now?
Yeah, I'm getting a thumbs up,
Okay, great.
lots of thumbs up.
We're also partnering with our community organizations that serve diverse families to improve outreach to them and also to provide cultural navigation in those communities. We're also looking very hard at aging caregivers and the supports that aging caregivers need to make certain that their loved ones, they remain in a community. And we're reviewing policies and practices through an equity and accessibility lens. And that's one of the main things that we've been looking at by way of the MidSec and making changes based on those findings, the very helpful feedback that we're receiving from our community partners.
The last theme, the desire for genuine community partnerships. Stakeholders want genuine partnership through work groups, regional meetings, and visible feedback loops. So what are we doing? We're sharing meeting summaries, timelines, and next steps so stakeholders can track progress. We're evaluating engagement practices regularly and adjusting based on stakeholder experience. Many of you may have received surveys after our last our listening sessions. We also sent out a survey during the first quarter of the fiscal year. I don't recall the month. And we're taking that feedback very seriously. We will be sending out a follow-up survey at the end of the year to see what additional areas of improvement exist. So we thank you all in advance if you filled out the survey.
Also, we're hoping that you see and feel our efforts to be out here with you all. Since July 1 of 2025, we've engaged in a little over 60 community engagements by way of in-person. My team and I have been in every region in the state, understanding that the rural counties are especially challenged by way of transportation and so forth. We've also been hosting webinars. And so again, we're hoping that you see the extensive amount of engagement that we have been participating in, just to make certain that you all feel heard and can help us transform this system.
All right, thank you. Next slide, please. All right, so now it's your turn. So we're going to have a discussion here. So just a reminder, each individual will have 1 minute to allow to share a question or a comment, and then whoever is the most relevant DDA staff person to answer that question will, which is why we wanted you all to know that, who's in the room. So just a couple of things to keep in mind, and we'll be rotating with the folks online as well. So we'll not be able to address a participant's issue, an individual issue. We may not be able to give updates on behalf of the departments or entities. We'll definitely take the information back as appropriate, and will not be able to address questions related to the ongoing fiscal year 2027 budget process. So got to wait for that to be released with that. So what I'd like to do now is we have a couple of microphones we can do. So I do already, let's go ahead and just jump in. Everybody ready? All right. So we do have a couple of questions / comments online. So I'm just going to go ahead and go to these two folks, which gives you all time to raise your hand, and we can either bring the mic to you or you're welcome to come up. So first question online. So this one comes from Rob. Rob, are you okay with me reading your question? Or do you want to? Going to take that as a yes. All right, this is from Rob. With regards to communication issues, could MDH start a process or a standard when they miss their timeline? Example, send a courtesy email to say, we are not going to hit our target date for response completion, but we will attempt to follow up by X date, X time. It's more of a comment there. And then the other question was from Martha. Martha had said, regarding the MidSec committee, are there any documents available about the committee, such as membership and discussion topics? Oh,
Figure out which mic to take.
yeah, no.
Yeah, what we can share, we can share the charter for the MidSec on our website, as well as who the members are.
And in regard to the communication feedback timeline updates, that's an excellent suggestion and is something that we definitely can incorporate into our processes.
Thank you. All right. Okay, so we took two online, so let's lob it here in the room. Ah, there we go. You get to run tonight. Thank you.
Good evening, and hello, everyone, and thank you for this opportunity to speak. And hi, Wesley. Beatrice. Fine, great. My question is for the SDS services, when will we have 5 full FMCSs? Because we have 3 now, and from what I've seen, we're still having serious problems with the 3 FMSs. So when will the contract, the RFP go out for the contract for new FMSs to be able to apply?
Okay, so acronyms.
So for those online, FMCS is Fiscal Management and Counseling Services. And the question is around when will the department re-procure, re-solicit, or rebid for those fiscal management and counseling services? We do not have a date at this time, but we will certainly share with the community when we will be posting the next request for proposals.
And also, the statute requires that we have 3 FMCS agencies, just for a point of clarity.
Thank
For
you.
those online, statute is the law.
Yes, thank you. Since we're making such a commitment to do plain language, acronyms can be, assembly block. All right. Before I go to online, other questions or comments for folks in the room that want to share? So for those of you online, if you see folks chuckling in the room, the owl actually hooted. So it was a little disconcerting, so our apologies. All right, well, while I'm giving folks in the room a chance to think. So there's a question here from Kaylee. Kaylee, I hope you're okay. And also folks, raise your hands. We're happy for you guys to ask your questions live. Question for DDA. Are you going to address and correct fellows' new hire packet requiring parents and designated reps to sign under the umbrella of authorized rep, which legally is a different definition than designated rep/parent and is a different definition under DDA's handbook terms?
Thank you for that question. I will have to take that question back and have conversations with the team just to determine or ascertain what the discrepancy is between what the policy and guidance and waiver suggests. And what Fellow is doing. Fellow is one of our 3 financial management counseling service vendors. Wesley Hunterman, who's in the room with us today, is also the point of contact for that contract. He's a contract monitor for that contract. So we'll definitely follow up.
All right, well, how about if we keep the theme with I'm sorry, one more time. FMCS is Fiscal Management Counseling Services. All right, who holds them accountable to follow their contract with the state?
That's Mr. Wesley Hunterman. Wes?
Yes, so again, Wesley Hunneman, and the Director of Administrative Services, and under my umbrella, I am also the contract manager for all 3 fiscal management and counseling services. So I would be the one who would be responsible for making sure that they're held to their contractual obligations. And as our Chief Operating Officer, Robert White, mentioned, if there were specific concerns, please do not hesitate to reach out to me. And I'm more than happy to look into it a little further and provide you guys with further updates. So thank you.
So
The current fiscal management services organizations you have are GTI, ARC, and the third one is
So we have,
GT Independence, ARC, and
All right, so it sounds like now folks can hear us. Yes, because I see the interpreter and I see thumbs up. Thank you all for letting us know that. All right. Thank you for your patience as we are working through this. Okay. Let's see. All right, let me make sure. Okay, so this is a follow-up question. What obligations are built into the contract regarding timeliness of vendor payments? Wes, looks like this is another question for you as you were working on this sound and the internet. Hold on 1 second, please, Patrick.
While Wes is working on the Wi-Fi issues, we don't have that answer. We'll have to go back and look at the contract. There's a lot of service level agreements in the contract related to different contracts and deliverables. We'll have to go back and specifically look at what the time frame is for vendor payments.
what we can assure you, however, is the DDA meets weekly with all three fiscal management and counseling services vendors. Wes is in direct communication, not only with participants and families who have individual cases that they need for the DDA to research, but also with the fiscal management and counseling services entities when we see that there are some common themes around challenges that the community is having. So Wes meets very frequently with the fiscal management and counseling services vendors, and also the fiscal management and counseling services vendors reach out to DDA in our close partnership to even make us aware of some things that we may need to address to certain that participants and families have the access to the services that they need.
That pretty much answered my question that I was going to propose, which is the review process by which the agencies are reviewed. for performance to the families. So, that has been a big concern for our family, is the performance.
So again, it's very close monitoring, very frequent contact, but please don't hesitate to reach out to the department if you have any specific concerns you would like us to address with any of our providers or vendors.
So to piggyback on that, there was a question along those same lines. Is fellow is not paying, from Susan, fellow is not paying vendors as per the guidelines and there are accounts payable dates. Invoices have delayed payments more than 30 days. When will this be corrected? So Susan, I hope the sound was such that you heard Marlena saying that that is something that they will take back and check into. Yes.
My question is more of a process question, back to the evaluation of documents that go back and forth. And I'm using this as an example. I'm not looking for any feedback on this, but we went through this process and submitted a document in May of this year, and still is in the evaluation process of what appeared to me to be a kind of a broken process. So we submit a document, they tell us it needs to be changed, we change it, we submit it, and they come back with more changes of the same document, meaning they're not giving me, they're going back to the old document, and it's happened like 8 or 9 times. So it appears like it goes through a process that has multiple steps, and everybody changes it differently. And I mentioned this earlier, but I used AI to track my changes. I basically took the spec, used AI to match the spec to make sure we answered the mail. I write proposals for a living for government procurement, so this is my alley. And I would tell you, after 5 or 6, well, I think we were on 8 versions now, and I'm still getting changes back on the same exact document. It seems like we can consolidate that somehow and have the review be complete. So when we get changes back or comments, we can, substantially change it and answer the mail. So that would be my comment. And I can give you facts if you want facts, dates, number of time. I can give you every version that I submitted as an example. And the last part, and I'm done, is I feel like I'm a sophisticated user, but I run a sheltered workshop group that have a whole bunch of people that aren't, that have single moms with, 3 or 4 kids and the special needs. There's no way they can work the process, and the nomenclature and all the acronyms and blah, 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 I couldn't even keep up with them. So I just feel like it could be easier for the people that need it, because they're the ones that need it the most. So those are my comments.
That is very helpful feedback, and we are recording this session, so we'll have an opportunity to go back and listen to those recommendations. As we are working with our various partners, we are looking at administrative burden, how we can streamline things, make things much more efficient, and also clearer for families and participants. So thank you. That's very, very helpful feedback, and one that we know we could do a different and better job at.
It's Beatrice again. I have another question. I know next year, self-directed will be in existence for 20 years. And so I've been doing it for 18. And that's the know me. But in the beginning, it was beaten in us that DDA is not the co-employer. I mean, we've heard that from sun up to sundown. But with the new policies that you guys put out in the SDS manual, it sounds more like you guys are taking a position of being the co-employer. So is that what you guys doing? Are you guys becoming the co-employer with the SDS participant?
We absolutely are not. Becoming the co-employer, those employment relationships remain as prescribed in our governing documents, and that is the waiver authority itself. What we are doing is based on feedback from our community partners, we're taking opportunity to clarify. We're also taking opportunity to make certain that we're in compliance with federal requirements, and that's the Code of Federal Regulations for the waiver authority. So we are not operating in a co-employer status or relationship at all.
So I've already given Wes a heads up. So this is a question from Kimberly asking to please summarize what Wes said earlier.
Thank you, Renee, and thank you, Kimberly. So I'm not sure what people were able to hear or not hear earlier. I know we've been working through some Wi-Fi concerns. But the questions all circled around our financial management and counseling services for FMCSs. One question was, what were the 3 FMCSs that are with the state right now, or contracted with the state? And that is Fellow, which was previously the ARC of Central Chesapeake, Public Partnerships, which is PPL, and GTI or Guardian Track Independence. So those are the 3 that do fall under my purview as the Director of Administrative Services. So I do also monitor those contracts, or manage those contracts, excuse me. So when there are concerns with the FMCSs, please don't hesitate to reach out to me, email or phone, and I will be happy to take a look into what the concern is. I think, as many of you might have heard earlier or not, Deputy Secretary Hutchinson did mention that I do meet with, and when I say I, there is a team of us that are here, Rhonda Workman, who's here with me today, that do meet with the FMCSs weekly to talk about different concerns that we hear in the community. If there's different things that we've got going on at DDA, just making sure that if there's any practices that need to be done with the contracts to stay in compliance, we work through those. So it's kind of a summary of what I had said earlier. Thank you.
And also those vendors are agents who act on our behalf. So they too come to the table with us and share concerns that they're hearing from participants and families as well in regard to how DDA can clarify and so forth. So it is a partnership there, just as it is with other providers and family members and participants as well. We work together because we need each other to make certain that services and supports are delivered in the most effective and appropriate manner.
All right, thank you. So I'm going to run through some questions because there's quite a few of them online. So I'm going to spend a little bit of time with some online questions. Some of these are just statements, so I'm just going to read them so that folks know that they're being heard. So this one's from Mary Beth, along the same lines, Wes, that what folks were sharing, contract says 10 days for vendor payments. All right. Goodness gracious, those of you online are going to keep me busy here. All right, it says here, Lorna did acknowledge this was from left field. Is there legislation or policy that allows a doctor to make decisions on behalf of a hospitalized disabled patient?
No.
Thank you. All right. Please bear with me. All right. Okay, would it be possible to get the names of the people on the panel who work with the FMCS's providers so we can connect with them? So Wes, if we could we'll put out your email. Is that, or something along those lines? How do y'all want to do it?
We have a dedicated email and Wes will share that.
Thank you, Robert. So we do have a dedicated SDS email. I did just drop it into Developmental Disabilities email for SDS, Self-Directed Services, FMCS, Fiscal Management and Counseling Services. Financial, excuse me, thank you. Didn't think I'd be talking this much tonight. No, so there is a email address that I did just drop into the chat. That is one that is monitored by myself and team members. So if there are specific questions around the fiscal management, counseling services, financial, I'm gonna get it right. Please go ahead and reach out to that. That is an email address that is monitored, including by myself. So thank you.
Also identical to how we shared written feedback post the 6 listening sessions, we'll also provide written feedback so that you'll have access to these resources as well.
Thank you, because that was actually one of the first questions before we ever got started was about the PowerPoint and the information. So thank you. Question from Karen. Administrative responsibilities are built into the rate for both providers and self-direction. So why can providers still use these funds for administration, but self-direction is limited to 10 hours per month and must request these funds separately? Feels like this is double dipping and we are not able to use the unallocated funds that are already in the participant's self-directed budget.
Yeah, Karen, thank you for that question. I think what you're referring to is under the self-directed service delivery model, there is the opportunity for people to request under individual and family directed goods and services, a service called day-to-day administrative supports. And so during the last legislative session, there was information that was passed that directed us to create a specific service for day-to-day administrative supports. And based on the funding that was allocated for that from the Maryland General Assembly and approved, we're able to provide up to 10 hours a month for day-to-day administrative supports for people that are applying to that. So I believe that's what you're referring to. And that was put in our recent waiver amendment. So with the Community Pathways Waiver Program and recently approved, becoming effective October 6th.
And I would just add that in our provider managed model, they have a different rate methodology that is based on their specific and unique cost structure.
I'm not sure. I mean, it's more simple for me, but I thought the question was previously under the funding model that I have been probably the first family that had received personal supports. And initially, when the funding was allocated to different categories, if one category was not being used for whatever reason, we were able to transfer the money into another category, and that's not something we can do anymore. Is that correct?
Thank you for sharing that question. And I'm happy to meet with you after and talk a little bit more. But what I can tell you is in the self-directed service manual that we have noted previously and continues to remain in the manual today, is that for some of the services, you are able to move some of the funding to support personal supports and some meaningful day services by moving that within those categories. So that currently does exist, which is separate from the day-to-day administrative support question. But I'm happy to meet with you afterwards and make sure that I'm fully understanding your question and share those resources for you.
Right, we're going to go back to, so folks online, you have asked for that email address that Wes gave. So he's writing it down and I'm going to put it in the chat for everybody. Question from Kimberly. Is there a timeline for the participants to gain access to LTSS? There have been a number of high turnovers with the CCSs and it appears they are starting over each time.
Hello. We don't have a timeline for my LTSS, but we are working on it right now. So coming up in the future, we did have a pilot for my LTSS. We had a number of families and CCSs come out and test the system and provide feedback. Oh, am I not on? Okay. Oh, sorry. Oh, so we had a number of people come out, CCSs and families, and provide feedback, and we updated our resources. We're going to be doing some more testing and probably do another pilot before we roll that out, but it should be coming up within the next several months.
Okay, so Elizabeth, my apologies that you have had your hand raised. It is not showing up on my display. So if you'd like to unmute yourself and ask your question, please do so.
Hi, thank you for taking my question. I actually have a comment of a message for our community and our lawmakers, and that is to defend the Self-Direction Act of 2022 that the legislature passed unanimously after a 6-month work group, a legislative work group. That was the ultimate listening session. Issues were discussed in great length. DDA, unfortunately, does not seem to have met its obligation to implement the law in good faith. Core protections of the law have been weakened. Family of staff is restricted. Individual family goods and services access reversed. The day-to-day administrator role essential for an aging community has been gutted. Overnight supports have been pushed out of reach, or are threatened, I should say, and access to the LTSS system has been forgotten. Last November's self-direction manual raised serious concerns about transparency, fairness, and even waiver compliance. Legislative reports from the DDA and the Department of Health misrepresented the strengths of self-direction and mischaracterized our community. Then wage cuts came, passed by law, but implemented by the DDA in excess of what the law intended. The next legislative session begins in January. If you care about self-direction, now is the time to act. Join an advocacy group, contact your lawmakers, demand that they defend the law that they passed. Speak up and show up. We won into 2022 by standing together, and we must stand together again before more is lost. Thank you for your time.
Thank you, Elizabeth. Mimi, your hand is raised if you'd like to unmute yourself.
Hello. I hope you can hear me. I'm very sorry if you can also hear my cat. He's getting a little hungry. But yeah, so in regard to communication and language access, there do need to be very clear expectations shared and followed. While Spanish speakers have now been partially included in discussions, we're still not sure when we can expect a Spanish translated manual. And Spanish is not the only other language spoken in Maryland. There's, again, a very large immigrant population in Maryland, and some other common languages include Korean, Mandarin, Urdu, French, just off the top of my head. So as far as a question, what is, if any, DDA's plan to ensure equity and inclusion regarding language access across Maryland? Thank you.
Sure. Thank you for that question. We are working on translation of various documents. So we'll be looking at that to make sure that we can provide that. And in terms of other languages, we'll also look in that and looking at some resources that may help us with translation.
Yeah, I would just underscore the last part. We are looking to see what the top languages are in the state of Maryland. We started with Spanish and we'll be expanding that beyond Spanish.
And just for everyone's situational awareness, I do want to go back to the previous comment in regard to the DDA's obligation to implement the law known as the Self-Directed Services Act of 2022. For those of you who do not know, the DDA is required by the Maryland General Assembly to prepare and submit to the Maryland General Assembly what is called a joint chairman's report. That report is available publicly on our website. We can also get that report out to all who are interested in understanding how the DDA is meeting its obligations in regard to the Self-Directed Services Act of 2022.
Thank you. Mary Beth, you have your hand raised. You'd like to unmute yourself. Okay, Mary Beth, I'm going to go to the chat because there's a question there and I'll come back to you, okay?
It just came,
This
it
is
just came
from,
through.
oh, there you go,
Can you hear
Mary Beth.
There we
You're
go.
here. Yes, now we can.
It was delayed in coming through so that I could access it. Okay. I have two questions and I know I have 1 minute, so here we go. First question is, when creating a self-directed services budget with a participant in the PCP, the only service that tells the DDA how much time they're going to need is nursing. Why is nursing services able to dictate how much time they're going to need to serve the participant, but not other services? That's my first question. My second part is, in the past, I understand that the funding that the legislature, and that's how they decided to give 10 hours of day-to-day admin. In the past, it was obviously funded through unallocated funds. A participant, support brokers are limited to 4 hours a month. However, sorry, that's my own kid self-directed hacking in the back of my car. Yeah, so support brokers can get more than 4 hours a month if there's money in unallocated funds to support that. Why are day-to-day admins not allowed to do the same thing? If there is money in unallocated funds, the participants should be able to add hours just like they can to a support broker.
Great, thank you for those questions. So I'm going to try to answer both of them based on my understanding. So the first one was related to why, I think your question was, why are nursing support services required or dictating or driving what services are being authorized? So a couple things I would say. Each person-centered plan is shared with the Developmental Disabilities Administration, our regional offices, and is reviewed based on assessment of need for services. Services are authorized and approved. Majority of our services do not require any nursing support services information. Personal supports, our meaningful day services can all be authorized without any intervention for nursing support services. When there is a request for enhanced services or enhanced rates, or when there's a request for dedicated hours, meaning additional 1-to-1 or 2-to-1 staff supports in addition to the base service, that's when, as per the federal, as per our federal authority under the waiver, that we require documentation to support that assessed need. And for those types of enhanced services or dedicated supports, if it's related to a health related need, that's where we would need nursing support services to be part of that, to review those needs and create a nursing support plan. So that relates to that. So they're not required for all services. It just would be a requirement if someone is looking for enhanced rates or enhanced services and dedicated hours. Going back to the day-to-day administrative supports, as I mentioned to you, the legislation and the budget process last year really drove and directed us to create a waiver amendment, and based on the funding that the General Assembly allocated for that service, it created a specific service, a standalone services out of the general goods and services under individual and family directed goods and services. So for that purpose, the use of unallocated fundings would not be part of day-to-day administrative supports. So thank you for those questions.
We're going to go to the room, and then we'll come back to online.
Hello, thank you in the first place for all of you showing up here. I tried to do one of these online, I don't know, 2 or 3 months ago, and it was close to impossible. So I appreciate you making the effort to get here and talk to all of us in person. I am an aging caregiver. I know that you said at the outset that you couldn't talk about the 2027 budget because you don't have it yet, and I fully understand that. However, I have already begun worrying about that, having gotten through the budget battle for last year. Our parents groups worked very, very hard. I lost track of how many thousands of emails and phone calls and everything else that we did. I guess part of my question is, in what way can we be of most help to you? I didn't hear anything from DDA as we were all going through this process. And I don't know whether there are bureaucratic reasons why you cannot speak out about huge amounts of money coming out of Medicaid and other issues that we worry about a great deal. Can you participate in that, or can we be of more help to you being the out front people as opposed to yourself speaking out from the roles that you have?
Thank you so much for that question, and thank you so much for joining us today. In regard to the budget, right now, the budget is still in development, so we are unable to talk about the budget. In regard to how you can help the DDA, we absolutely would love that. The MidSec is a way, we have representatives on the MidSec who should be talking with their specific community groups to get feedback. The Waiver Advisory Council is another means and platform for family members and participants to engage with us. We'll share our dedicated email address as well if you have any ideas that you can share with us as you're thinking through some of the ways in which DDA can make its program more accessible, equitable, sustainable. We're totally open to that. And thank you so much for being here with us tonight.
I wanted to go back to Rhonda's discussion about assessed need, and it was I just had a suggestion. It would be really helpful, I think, for I work with coordinators of community services, but also with families understanding and providers to very strictly formalize what that assessed need looks like. Sometimes it feels a little open to interpretation. We try to fill the case to explain the request, but it would just be really helpful. I know in the past, certain things like health risk score would trigger a certain service being applicable. So wherever possible, if we could formalize what strict documentation or what you're specifically looking for, it might help us narrow that down and get that to you in a timely.
Thank you. All right, I do see, okay, so Kristen, I do see your hand, but I've got several questions in the chat, if I could run through them really quickly. Karen had multiple comments about the legislator, what the legislators passed. It may be the funding for day-to-day is already built into the rate. And then, hold on a second, she had a couple, so if I could knock them out, they might clump together. Yeah, the legislators asked for the day to be separated so that it would not be capped at 5,000. It's now capped at less than 4,000, and teams have no way to have these tasks provided. Does DDA have a plan for how to meet the participants' needs?
Thank you for that question. So when the Maryland General Assembly passed DDA's budget, they allocated $7 million in general funds, or that means the portion of the rate that the state pays for, and then we get another 7 million from the federal government for a total of $14 million. And so looking at the service definition for day-to-day administrator, as well as the number of people who may want to access that service, we came up with 10 hours per month. Now, prior to the legislation, when it was part of the individual family directed goods and services, one could get day-to-day administrative services if they had the assessed need, but also had to fund it using savings in their budget. And so that did present an equity issue for individuals who wanted to access that service and did not have the funding to do so. So when we broke it out, we ensured it didn't become part of the $5,000 cap, but now anyone who wants to access that service can access that service. Now, the Developmental Disabilities Administration will continue to monitor utilization as the fiscal year continues and make any changes if necessary based on what that utilization is.
I would also like to note that as a result of the service being as standalone service, the Centers for Medicare and Medicaid Services, also known as CMS, which is the federal authority by which we must operate and be in compliance with, required the DDA to pull that out as its own service line. And we have to make certain that individuals who are self-directing their services have access and that it's equitable. So as Robert, Chief Operating Officer White had mentioned earlier, in regard to it being an equity issue, it was a huge equity issue. And we have to demonstrate to the Centers for Medicare and Medicaid Services that we are making certain that everyone who is self-directing their services have access to the services that they need.
And just to add a little bit more in terms of making sure people are being supported in their needs, we have a variety of services in the waiver, personal supports, employment, a lot of different services that we have noted in that self-directed service manual and in the waiver application itself that can support individuals in some of those needs. We really want to walk alongside participants and support them in terms of learning and being independent. And we know that's going to be different for each individual. But we really, as a service delivery system, and we want to support people and put people in the center, we want to walk alongside them, and we have a variety of supports and services that can assist with a variety of things based on those needs.
I have another question. The support broker, I'm a support broker, and the coordinators, we're on the front line. We're on the front line. And the about 10 years before, we used to have monthly meetings with the regional office, the support brokers, and then even the coordinators will come in. And during that time, we were able to talk to the SDS coordinators about what's going on in the field and what we're experiencing. And then they were able to guide us and help us and then take it up to you guys. So once those meetings stopped, that's where all the confusion came in and we were lost, because we're so used to having communication and guidance. So for me, I feel that that would be a great asset to go back to having the monthly meetings with the support brokers and coordinators, just the front lines, so that you guys don't have to keep coming out, talking to us. Because if we just had those types of meetings, then you would hear directly from us, and then we can be able to work together. But you guys are doing a great job. I'm not complaining. I'm not, but it's just, I just saw that when we was able to talk monthly, it was so much better to what it is now. Thank you.
So thank you so much for that helpful feedback. First and foremost, we want to be out here with you. So thanks for welcoming us. But second, thanks for that feedback. We'll definitely take it back. As we continue to provide additional platforms and forums for all of the individuals involved in the participants team to engage, we'll certainly extend those to you. Thank you so much.
Thank you. So Irene, I see your hand is raised. I'm going to read a comment in the chat so that'll give you time to unmute yourself to ask your question. This is a comment to DDA from Kaylee. CCSs should be required to take annual certification to show they know the program and that they have read the handbook. All right, Irene, have you unmuted yourself?
Yes, can you hear me?
We sure can.
All right, wonderful. Oh gosh. Okay, so I have a nuts and bolts kind of question. Since there is a cap on the IFDG, I'm sorry, individual and family directed goods and services of 5,000, I work with someone that, I know music therapy was capped at $50, but you know, music therapists are actual, like they've studied for it. I mean, they charge usually more than that. And I understand that there's a cap, but if there is a resource to pay above that cap, is that allowable? That's not I mean, that shouldn't be a violation of any rules since it's not a waivable service. Is that right? And the other thing that, I'm sorry, I know I'm trying to squeeze it all in, sorry. I also want to say that I work with people who live alone, who don't have family as staff, who don't have family, period, in their circles. I feel like recently, a couple of people have been like pressured to do provider managed services, and I don't think that that's appropriate. These are folks who've lived on their own for a while. They need supports, but it doesn't mean that they can't live on their own with the right support. So I just want to just point that out, that there is a process, and that everyone should be given the opportunities to find those resources in order to continue to live independently. Um, so in those situations, I find that staffing is not like they don't always need like someone with them, like side by side. So if there is a way to eventually make the day-to-day administrator type position into a waivable service, or something where it's more like case management instead of direct support, you might have like basically an audience for that, because people maybe they just need like some like checking in, or like someone to help them with like refilling their medications and things like that, that it may not require like a lot of intense hours. So it could be cost effective, but also very helpful and meaningful for people to live independently. So yeah, those two top comments. Thank you.
So just a little bit of feedback related to that. So first, thank you so much for sharing your suggestions related to day-to-day administrative support. We'll definitely take that back and look at those suggestions related to it. In terms of music therapy, for individual and family directed goods and services, we did share standards related to what would be reasonable and customary. And that was based on a review of information for the different types of goods and services. We'll continue to assess that and make adjustments based on information that we get related to that. And happy to take back your comment or suggestion to look at whether individuals or families could supplement or pay above that. We would want to make sure that we check at that related to federal authorities, because really the payment should be payment in full.
Okay, thank you. All right.
Renee, I just want to address
sorry.
the other part. So no person should be forced into one delivery model or another. If that is happening, we definitely want to know about it so that we can address it.
And as always, if there are suggestions in regard to our service definitions, please don't hesitate to leverage the Waiver Advisory Council to share those suggestions. We also want to make certain that everyone understands what those service definitions are. So we'll be
working at the Waiver Advisory Council for everyone's situational awareness. One of the things that we have to be very careful about as we implement this program is to make certain that things are conflict-free. And so when we are developing our services or fine-tuning, polishing the service definitions, we're always looking at ways in which the services can be delivered and then there's no conflict there, because it's really about the person first and the families who are there to support them. So please do not hesitate if you have any suggestions in regard to our service definitions to leverage the Waiver Advisory Council to share those recommendations.
Thank you. So Jessica, I see your hand, so I'm going to take a question because it's about the waiver advisory from the chat. And Jessica, so you can work on unmuting yourself. When will the last waiver advisory group meetings be published on DDA's site?
Wes is a great help because Wes helps to get everything on the website. So it's my understanding that information is and has been updated on the DDA website. We have a dedicated webpage for the Waiver Advisory Council. And when you go to that, you kind of scroll down, we have a lot of banners, and one of them will say meeting materials, and it will include all the materials for the November, September, October, all those meetings. Everything will be up except for the meeting minutes for November, because the council will then be reviewing those and voting on those during the December meeting. But you can go on. We've got recorded meetings. We've got the minutes. We've got the agenda. We've got meeting materials. We'll continue to enhance and update the Waiver Advisory Council website as we move forward. So thank you for sharing that.
Hi. Jessica, you unmuted yourself so you can ask your question?
Hi, thanks. I'm going to try and keep this super brief. It's a little bit of question, a little bit of a statement. I'm growing increasingly concerned over eligibility and integrity in our systems. And so I was curious to find out from DDA what they're doing to strengthening that and to making sure that like HCBS services do have a place in long-term services and supports, and more specifically related to like the equity and the equality. So it's becoming really, really concerning, and not just from a family like mine, but they're often being used pretty interchangeably, the two words. And for developmental disabilities, that's a huge difference. And, we all know that equality suggests that everyone starts at the same place, but equity recognizes that people like my sister who live with complex, lifelong, disabling conditions that no amount of support or therapy or opportunity will ever fully level out. There's not anything fair about being born with a condition that affects every aspect of your life. And the fairness doesn't come from pretending everyone can reach the same outcomes. So I was just curious on what we're doing to kind of really, really maybe strengthen that eligibility portion of it and not leave out the most complex people that this program was intended to serve, because I'm not hearing or seeing or feeling like there is anything else in the same space within CMS's umbrella that would support complex individuals long term. And so, I listen to everything. I attend all the meetings. I hear everything. And there's a lot of priorities being set by DDA. A lot of fantastic, what I would call like extracurriculars. But we cannot lose sight of health and safety. It's a Medicaid program. And so the things that get jeopardized, even with MidSec kind of evaluating the budgets and the exorbitant costs and things like that, you really have to make sure that we're not losing the sights of the people that need it the most. So I'm just kind of curious to hear what DDA thinks about all of that.
So first and foremost, thank you for your feedback and thank you for tracking very closely the DDA's efforts. First, I want to just make very clear that individuals with complex medical needs can be served in the DDA
waiver program. We have been doing that. We continue to do that, and we will continue to do that. By way of a Medicaid waiver authority, individuals go through a person-centered planning process. And so when we're talking about their needs, how they are being assessed, how they're able to access them, and whether or not it's equitable, that's why the person-centered planning process is critical. And it's the crux of the development of services and supports for individuals. It's also very important to note that the Home and Community-Based Waiver Authority allows individuals to actually access other state plan services by way of the Medicaid program. And so it sounds like you have some situational awareness around those waiver services that are offered by DDA. And then there are some optional state plan services by way of this waiver authority that individuals have access to, in addition to what the DDA provides. That is designed that way to make certain that individuals are living very safely in the community. It is all about the participants' health and welfare. The DDA, by way of operating this Medicaid waiver authority, is required to demonstrate to the Centers for Medicare and Medicaid Services that we are operating a safe program that focuses on an individual's health and welfare needs. So it's right in the forefront of us at all times operating, because it's one of the assurances that we must continue to meet in order to operate this authority.
Thank you. All right, question from Kimberly. Can you please share why the support workers are now required to submit a SIP/agreement, and who is responsible for drafting this document? And CCSs are creating and submitting this information outside the team.
Yes, thank you so much for that question. So as per the Self-Directed Services Manual, individuals that are supporting individuals being hired, there should be either a job description that kind of talks about what the individual is going to be doing. That would include a support broker, or the participant as the employer could utilize what is called a SIP, which stands for a Service Implementation Plan. So really there's two options. So as an employer, the participant would either have a job description for the staff or people, the vendors that they're using and providers, or they can utilize a service implementation plan. There should be a process where the person is at the center and making those decisions related to those job descriptions or that service implementation plan. It must align with the federal authority. So there shouldn't be things in that job description or that service implementation plan that's outside the waiver authority, because we can only support and fund those things within the purview of the authority. And that should be an effort with the support of the team. I think if there's any concerns related to that, absolutely reach out to the coordinator of community services. You can reach out to the regional offices. Our directors are here. We also have self-directed service leads that are available. So if there are concerns related to that, please reach out to us. We're happy to look into it and support that. But again, really, there should be either a job description or you can use a service implementation plan. So that's really the option of the participant as the employer.
Okay, thank you. All right, I see you. So hold on one second. Let me read this real quick and then we'll grab both of you all. Thank you. Who wanted IFDGS and didn't get it? Or are you talking about the traditional agencies who don't understand that administration and program costs are built into the rate and think they should have it too?
Individuals and family directed goods and services, so IFDGS, so that we make sure we're talking about the same thing. Robert was mentioning that we really want to ensure equity and people being able to access that under the model. And so by having it as its own designated services with a funding authorization amount, it allows all individuals under the self-directed model with the assessed need to access that. Some individuals do not have or did not have cost savings to be able to access that. And so that's what we were talking about in terms of making sure and having that opportunity for people to access that.
And individual family-directed goods and services is unique to the self-directed services delivery model.
My question is, under the new consolidated waiver, what impact, if any, is anticipated to the number of people on the waiting list for active services? And also moving forward, will there be initiatives that are similar to the ones that pull people from like the family supports waiver?
Yep, thank you for sharing that question too. So with the consolidation of the waivers, so what we're talking about is the DDA used to operate on behalf of Medicaid, 3 Medicaid home and community-based waivers. It was the family supports waiver, the community supports waiver, and the community pathways waiver. When we consolidated those or put them all together as one program, all under the community pathways waiver, all the individuals that are currently enrolled in those other 2 programs were automatically moved to that program. They maintain their enrollment in those services. And we also looked at what we call reserved categories or slots or spaces, if you will, that we hold for certain kinds of priorities or population or categories of people. One of the biggest one would be what we call transitioning youth. And so we move that over so that we can continue to support individuals on the waiting list that are transitioning in. We also have some reserved spaces for a variety of different things, people that are transitioning out of institutions or nursing facilities. We have spaces for families who have multiple children on the waiting list. So those were all considered and consolidated or moved together under the community pathways waiver. We will continue to assess that, and based on funding that is allocated and available to us, as we look to maintain and sustain our programs, then there could be those opportunities similar to what we did under the other programs.
I kind of had just a couple, I guess, maybe clarification statements slash conversation maybe we can have regarding a couple different things that were said. I guess the first one was the gentleman behind me was talking about the idea of being able to get a hold of people within different vendors, whether it be fellow, whoever, especially when you're talking about the fiscal management. One of the common trends that seems to be going, just because we hear from people a lot on the shore, based on kind of what we do, is that there seems to be this lapse in conversation. For example, somebody will contact one of the FMCSs, the fiscal management, put a ticket in, what have you. They will have someone feedback. When the email comes back, and then we will end up replying to that, we get a whole new person and the process starts over. We spend a day, 2 days, 3 days getting absolutely nowhere because we get a new person every time. One of the things that might be suggested in that opportunity, if this is an option, don't know that it would be to have someone accountable to that, to have them assigned. That way, when this comes down, we start having this situation, at least there is someone that is on the other side of the line that is continuously following the issue. Rather than having this, what seems to be, it's almost like a recording, so you keep playing it back, keep playing it back. So that would be one suggestion I would have. And then regarding one of the other statements that was said online regarding equality and equity would be another thing that we hear constantly here is that on the Eastern Shore specifically, there is more of a lack of vendors available in certain ways in certain aspects here. With that, some of these vendors also have their own idea of who they could and could not serve. One thing that seems to be common is the more of the severity of the disability, the less likely there's going to be a service, including personal support. There are vendors out there that have specifically said that they're not willing to accept and offer personal support for some people based on a disability if they have a behavioral plan. That seems very uncomfortable for a lot of families out here because of the lack of services that are available out. We already know when you're talking to a specialist, we're going to the Western Shore. If you have a family, you're taking a kid, whatever the case may be, somebody's calling out of work, you're spending the whole day driving, going to the appointment, driving all the way back. And then you have the services here. If they are here and are local, hopefully they will serve you. So not only is there a concern about services, but there's a concern about people being willing to accept participants on for the services. And so I feel like that would be something we could specifically need to address. But I just want to put those couple of clarification statements out, just to make sure that we're all kind of on the same page. I do see what you're saying regarding the FMS and Medicaid, kind of understand that, respect that. But specifically on the Eastern Shore, I can say that there's more to it than that as well, that we might want to address.
Thank you. That's very, very helpful feedback. And I encourage you to leverage one of our many platforms to help us think through that. Thank you so much.
All right, online, Elizabeth, I'm curious about why DDA chose to lift the 82-hour cap on personal support services for the traditional service model. What is the projected cost impact of that change?
Yes, thank you for sharing that question. And the reason why is because all of our services are based on a person-centered plan and assessed need. So whether you're in the community provider managed model or the self-directed service delivery model, we would look at those assessed needs for personal supports.
Thank you. Question from Michelle. Why is the new rule that a day program can't be funded if it only serves individuals with disabilities being applied retroactively to budgets that were pending prior to the new rule?
We're going to take that question and look into the specific concern. And if you wouldn't mind, we'll share that dedicated email address so that we can look into that concern, make sure we understand it fully.
Okay, thank you. Let's see. All right, you all online are doing a really great job. I just want to make sure that I'm capturing it. Okay, so bear with me. Okay, here's a question from Lisa. What do you what do you recommend that participants do when reimbursements are processed in a timely manner? I've submitted multiple times for reimbursements of services rendered that are in my son's budget, but have been waiting for over 3 months for reimbursements. I don't understand the accountability process for FMCSs. Would you please explain that accountability process? I know that was you, Wes.
Thank you, Renee. Can you say the top part again? I'm sorry, I was.
Sure. What do you recommend that participants do when reimbursements aren't processed in a timely manner?
Thank you. And thank you for that question. So I think kind of to go back from what we were discussing earlier, if there are what we like to call participant-specific concerns, you can reach out to that dedicated email address that was shared earlier in this meeting. You can also reach out to me. Generally speaking, there will be some kind of information that I'd be looking for, depending on whom the financial management counseling service provider vendor is. I would be asking for a potential ticket number if there was one submitted. Just trying to gather specific information so that way there, when I do my follow-up, I'm able to provide them with the most specific information to best address your question.
And again, I want to reiterate that the fiscal management, financial management and counseling services vendors are accountable to DDA. They work in partnership with us. And so again, as you are experiencing any challenges, or if you have recommendations as to how we can do things differently or better, we're certainly open to that. They're at the table with us. It's all about the participant and families first, to make certain that individuals are getting the services and supports they need. So we are totally open to any recommendations to help us make certain that the service delivery system works for the participant.
And following up on that, this was a comment about, I believe that the FMCSs should notify participants of their appeal options whenever payment is denied. Isn't that the same thing as a service denial?
So I'm trying to make sure that I'm following this question appropriately.
Do you want me to read it?
Yeah, if you want to read it one more time, just so I
Okay,
can make
sure.
sure.
It is getting to be 7:40 at night, so yeah, I understand. I believe that FMCSs should notify participants of their appeal options whenever payment is denied. Isn't that the same thing as a service denial?
Yeah, I think it depends. Are they denying payment because it doesn't meet their specific requirements as it comes to invoices? Invoices have to contain certain information in order to be processed. Any denials for services related to the person-centered plan should come with appeal rights. But if you're just talking about submitting an invoice and the FMCS is pushing it back, either it doesn't meet the requirements or the supporting documentation isn't there, that would be something totally different.
And if there is a service denial, we encourage participants to please exercise their right to appeal, and their coordinator of community services, it's a part of their responsibility to help the participant with that appeal process.
Right, thank you. Mary Beth, you've got your hand raised. Would you like to unmute yourself?
Yes, I have two questions or two statements about the FMCSs. First of all, there are double standards for invoicing. Not all vendors have to meet the same requirements in their invoices. And that really is unacceptable in my opinion. All vendors should have to meet the same requirements, but they don't. And the second thing is the participant has to authorize payment for everything out of their budget each time it comes out, except for the FMCS. They are allowed to take their payment without the participant authorizing that withdrawal or that payment from their budget. And then along that same line, why can't a participant withhold payment from the FMCS if they are not living up to their end of the agreement and doing what they're supposed to be doing?
Thank you for those comments. One point of clarity. So when individuals who are in the self-directed model go through to complete their SDS budget sheet and they select their FMCS agency, their fiscal, their financial services and counsel, their financial management and counseling services vendor, the budget is automatically decremented or it's automatically deducted from the budget. The financial management and counseling services agencies have to submit an invoice for their payment to the Developmental Disabilities Administration. And we go through a very stringent process to ensure that the invoice that they are submitting is proper and can be paid, including looking at the number of individuals who they are servicing. So that's how the financial management counseling services agents are reimbursed. As far as having different standards for different vendors, it should be standardized with the same financial management counseling service agent. Meaning, so if Fellow has a process, their process should be standardized across vendors. Now, Fellow's process may be different from GT's, which may be different from PPL's, but within the same company, the process should be the same. And if not, please let us know and we'll look into it.
All right, thank you. All right, comment or question. Can we please discuss for a moment the sustainability concerns with the traditional model? Will DDA make a conscientious effort to understand the exorbitant amount of overspending or entitled spending that has historically taken place while also ensuring that providers do not shut down or go bankrupt? How do we currently suggest to do more with less? And truly, it should be based on individual needs rather than provider needs. Also, the person-centered planning process should suffer the same scrutiny. Reviewers should not be aware of which service model is being selected when trying to evaluate and or scrutinize a requested need.
In regard to the Maryland Intellectual and Developmental Sustainability and Equity Committee, also known as the MidSec, that committee is looking at all of the DDA's cost drivers. So we are looking at utilization, which translates to expenditures. We are looking at populations. We are looking at service delivery models. We are looking at behaviors. And so we are taking a very holistic approach when looking at these cost drivers. So it's not a matter of DDA looking at one service delivery model, favoring it or outcasting another. Both service delivery models will remain in place. Self-direction will remain in place. The community managed provider model will remain in place. But we have to understand why utilization is going up and why expenditures, they're going up, but at the same time, the number of individuals is not increasing. So it does not match the enrollment as compared to utilization and expenditures. It does not match. And so that MidSec is working with the DDA to understand what those cost drivers are, what the behaviors are. And we are talking through different ways we can look at data to get a better understanding of what's happening within the service delivery system at large as a whole. And that is a true inspection of not only the two service delivery models, but also the person-centered budgets that are being approved by the DDA as well.
All right, thank you. So, okay. My screen went blank there for just a second, so I apologize. So I have 10 minutes till 8. And so what we're going to do is take a couple of more comments from online or in the room, or raise your hand, and then we'll do a quick wrap up if there are any comments. So I'm going to go to online, but those of you that are in the room, if you've got anything, please let me know, okay? All right. With the new healthcare policy that now will not allow an employee who has a plan with their spouse to be covered, that employee will now purchase a more expensive policy on their own, and the participant will provide an allowance for the employee, and now this will cost taxpayers more money. Has DDA thought about the implications of this?
Thank you for sharing that. So just so that we're on the same page, under the self-directed service delivery model, participants as the employer can offer reasonable and customary benefits. One of those includes health insurance for the employee. And so what this person is referring to is really plans that are being purchased that are for family plans and such. So we appreciate that feedback related to that, and something that we can take back and consider.
Oh, okay. All right, here's another. I see you. Hold on, let me read this and then I'll get you, okay? All right, I understand that this is from Patrick. I understand the change in program rules means that a participant or family member cannot be reimbursed for a service/product supplied by another party. For example, a gym membership. Related question, is it possible for the participant or family member to get reimbursed for out-of-pocket expenses incurred before the change in program rules went into effect? And will DDA increase accountability for the FMCSs around vendor payments without additional scrutiny and accountability? How can a participant go to a community-based provider like a gym and assure them that service cost will be paid timely? Assure, thank you. Thank you so much. Sorry about that, Patrick.
So what the question and what we're talking about relates to under self-directed services, individuals are able to request and utilize what we call general goods and services, gym memberships and things like that. Our financial management and counseling service providers have a special designation that allows them to purchase things from other entities that are not Medicaid providers, such as gyms and community activities. And really what we are trying to support is the access and equity related to that, so that the financial management counseling service providers are facilitating and paying for that, so that individuals, and particularly we know that some parents are putting out of pocket costs to pay for things out front. And we really want people to be able to access those services and activities without having to come up with the money, because that's not something that's available to everybody. I know we've had some comments and questions related to vendor payments. And so Wes is here and I'm happy to look at those things, but that's really what we're looking at. We are looking at the reimbursement and discussing with our other partners related to maybe some additional opportunities and flexibilities related to that.
Just second part of that, just a comment on the first part. We are continuing to work with stakeholders in our financial management and counseling services agencies on how to operationalize that. We have received feedback from our community, which is why we did pause implementation of that. We want to make sure that there are no unintended consequences, addressing some of the concerns that were brought to our attention prior to the change in the waiver. That there was a point in time when parents were required to put out large sums of money and then being reimbursed. So we're really working on a process that will be flexible while meeting the needs of the individuals that we're here to serve.
Okay, my last question, I promise. It's about the units, because before, the problem that I've seen is that families and the individuals, they still had money in the budget, but the FFCS stopped paying because they said they ran out of units. And that's where a lot of the frustration is coming in, that because the families and the team receive the money, but we cannot utilize those funds. So how can we utilize those funds, or is it just a no-go?
So thank you for sharing that question. And really, it really depends on what we're talking about in terms of the services, right? So individuals may have funding in their budget, but those services are not authorized, or that level of services, those units are not in the person-centered plan. And remember, as per our federal requirements, we authorize services in the person-centered plan based on assessed needs. So if there is an assessed need for additional units, then really the individual can work with their coordinator of community services to submit a revised plan to share additional needs and additional units that can be looked at related to that. So it really depends on the individual and the service. And, please reach out to us, our regional office, our directors are here, and our teams to kind of look through that. But if there is a need, really a revised plan would be something to look at.
All right, thank you. So we're right at about 3 minutes to, so let me wrap things up real quickly here. So for those of you that put questions and comments in the chat, I tried hard to get as many of them as I could, but if I did not get them answered, they are being collected. as part of everything tonight was recorded, so it's all being collected, all right? So I want folks to know that and hear that, all right? Even if we didn't get to ask your question out loud or share your comment out loud. We always ask the question, so what's next, right? So what are you gonna do with all of this, right? And so just like with all of the multiple listening sessions we did the last time across the state, DDA collected all of that, synthesized all of that, and then brought it tonight to you all. We're going to be in Western Maryland Wednesday night, yes. This is the DDA Traveling Roadshow, so it's awesome. I do appreciate, as a person who doesn't live on the shore but does understand what it means to come across the bridge, I do appreciate it. I know the folks that live on the shore really do appreciate when folks come across the bridge. So thank you very much for doing that. That is huge. The other piece is, so then that comments from that, questions will also be all collected and synthesized again and taken back and worked on, what is it we need to be looking at? What does DDA need to be doing differently? What can we do to improve and take all of these feedback? So that is so stay tuned. It is coming. Did I capture all of the next steps for all of our DDA folks in the room? All right, great. So 2 minutes left. Because we are going to lose our interpreter at 8 o'clock. So that is, we don't want to lose that accessibility for folks. Any other last comments?
Again, I just want to thank everybody for coming out tonight, welcoming us, sharing with us, and also working with us, partnering with us. If it's not a time more urgent and important to work together is now. Especially what's happening on the federal level. And so we really appreciate you coming out tonight, sharing over the course of the listening sessions, being willing and able to continue to engage with us and partner with us. We're really here with you. We are here with you. We heard your feedback. It was very helpful. We hope you begin feeling and seeing our commitment to you as our community partners to really right this ship, make it much more accessible, equitable, and sustainable. As we get additional information, as we are out and about with all of you, we will continue to share. As I mentioned earlier, we will have written feedback for your situational awareness once we continue this leg of the tour, because we've been on tour for some time and enjoying it a lot. But again, we really just want you to be a part of our continuous and ongoing engagements. We don't know everything. We cannot do this alone. And so it means a lot to us to have you here with us as our partners, helping us make certain that the individuals who need these services and supports, as well as their families, get them. So thank you so very much.
I hope everybody travels safe and stays warm. And then you folks that online are warm. So I hope everyone has a great evening. Thank you.